So today's topic is the blood supply of the optic nerve head. I am Dr. Pooja, and today I am going to teach this blood supply of the optic nerve head through this diagram. So before starting the blood supply of the optic nerve head, we should know the parts of the optic nerve head. So parts of optic nerve head. I know that you all know, so just for a revision, I am just telling it. The first layer of the optic nerve head is the surface nerve fiber layer. The second layer is known as the prelaminar layer or the prelaminar region, we can say. And the third one is the lamina fibrosa or fabric. Lamina fibrosa region. And the fourth one is the retrolaminar region. So we will learn the blood supply of the optic nerve head, which is the favorite question of the examiner in the postgraduate examination, and we will learn the blood supply in a very quick way just by this diagram. So first layer that we know is the surface nerve fiber layer. So it receives its blood supply from the retinal arteriole, which anastomose with the vessels of the prelaminar region. So we can say these are the capillaries that we are talking about. These are the retinal capillaries present in the peripapillary area. So we are telling it as a radial peripapillary capillaries, and it anastomose with the vessels of the prelaminar region. Okay. Now we are talking about the most common blood supply. Then the second one is the prelaminar region, and the prelaminar region derive its blood supply from the vessels of the ciliary region. But there is some thoughts, or we can say the different thoughts. But there are two school of thoughts that suppose that some things that the vessels of the ciliary region which supply the prelaminar region, they are derived primarily from the peripapillary choroidal vessels, while the other thinks that it is derived from the short posterior ciliary arteries. Then next comes the lamina fibrosa. The lamina fibrosa or the lamina fibrosa is derived its blood supply from the ciliary vessels, same as that from the prelaminar region. But these are derived from the short posterior ciliary artery, as according to the one school of thought in the prelaminar region, and from the circle of Ginhaler. So the lamina fibrosa is supplied by the ciliary vessels, and these ciliary vessels are derived from the short posterior ciliary artery and from the circle of Ginhaler. So lastly comes the retrolaminar region, and the retrolaminar region get its blood supply from both the ciliary and the retinal circulation, with the former coming from the recurrent pile vessels. This former is the ciliary vessels. So the ciliary vessel is coming from the recurrent pile vessels, and it also get its blood supply from the retinal circulation. And the central retinal artery provides the centripetal branch and also the centrifugal branch. This is the central retinal artery which provides the centripetal and centrifugal both branches, and the centripetal branches are derived from the pile vessels. Okay, so I think everyone is clear about the blood supply. So now I am just revising. on a paper. First part is the surface nerve fiber layer. It receives its blood supply from the capillaries derived from retinal arteriole, and these capillaries anastomose with the second part of the optic nerve, with the vessels of the second part of the optic nerve head, that is from the to prelaminar region. And these capillaries were named in the diagram as the radial peripapillary. Can remember it as a radial peripapillary capillaries. Now the second part is the prelaminar region. It receives its blood supply from ciliary region. So after the surface nerve fiber layer, the prelaminar region, the lamina fibrosa and the retrolaminar region, all are deriving its blood supply either completely or in part by the ciliary circulation. So the blood supply which is received by the prelaminar region is derived from the vessels of the ciliary region, and these vessels are thought to be derived by either peripapillary choroidal system or from short posterior ciliary arteries. Then comes the lamina fibrosa. It also derives its blood supply from ciliary vessels and these are the ciliary vessels of the which are supplying the lamina fibrosa are derived from the short posterior ciliary arteries and arterial circle of Jin halo. So just going back to the diagram, this is the blood supply of the surface nerve fiber layer as we have discussed. Then this is the blood supply of the prelaminar layer, that is the peripapillary choroidal vessels or from the short posterior ciliary artery. Then this is the lamina fibrosa derives the blood supply from the ciliary vessels, and these ciliary vessels are derived from the circle of the Jin halo and the short posterior ciliary artery. And in case of the prelaminar region, there were two schools of thought. Either it is derived from the peripapillary choroidal vessels or from the short posterior ciliary artery. Then the last layer is the retrolaminar region, last layer, or we can say the last region of the optic nerve head. It is also supplied by the ciliary artery, or we can say the ciliary circulation. along with that, it is also supplied by the retinal circulation. So and in this case, so in all the layers we are talking about the where the ciliary circulation of the each layer is coming from. Okay, so in this case the ciliary circulation is coming from the recurrent pial vessels, and the retinal circulation is coming from the central retinal artery, which gives both centripetal and centrifugal branch, and the centripetal branch comes from the pial plexus. So lastly, we can make a short trick to remember the blood supply of all the layers. So the optic nerve head, it is composed of the 4 layers, that is the surface nerve fiber layer, prelaminar layer, then lamina cribrosa region, then the retrolaminar region. In this and in this, only the blood supply from the retina is coming. So the retinal it is getting supplies from the retinal capillaries, and it is also getting supply from the retinal circulation. And then the remaining, it is received the blood supply from the ciliary circulation, and same it is also supplying the ciliary circulation, but there is twist that the last layer is getting the benefit of the all because it is coming in last, so it will get the benefit of both. So it is supplied by also the ciliary circulation. Now we will talk about the from where these all circulations are derived, because ultimately they are derived from the different vessels. So they have the different names. Retinal capillaries is also known as radial peripapillary capillaries. Okay. Now the ciliary circulation, there were 2 schools of thought, as we know. One says that this circulation has come from the peripapillary choroidal circulation, and the other school of thought tells that it comes from the short posterior ciliary artery. Now this lamina cribrosa ciliary circulation comes from the short posterior ciliary artery and also from the circle of Jane-Hallard. For the retrolaminar region comes from the recurrent pial vessels, and for the retinal circulation, which is divided into the centripetal and the centrifugal part of the central retinal artery, and the central retinal artery centripetal branches is derived from the pial vessels, only the pial vessels, not the recurrent pial vessels. Okay, so retinal circulations come from the central retinal artery, the central retinal artery is divided into the centripetal and the centrifugal, and the centripetal derived blood supply from the pial plexus. Okay, so this was the summary of blood supply of optic nerve head. So this table you should mark up for giving in the exams. Thank you so much.